Is there a somatosensory catastrophizing scale that can be used across patient populations? Like pain versus head trauma versus dizziness? That was Bridget's question.
If I can ride the coattails of Donna and Jamie, I hope so. I know that we've talked about it, and I'm also working with some other groups where we are actually trying to validate pain catastrophizing scales and fear avoidance scales in this population. So I don't think it's there yet. I do think, though, that as Jamie said, it was very interesting to hear Jamie, for each of her visits, she uses an anxiety and depression scale. Now she's treating alleged concussion patients. So I think, and I'll defer to my two colleagues, but we also use a depression scale and anxiety scale, and we're starting to introduce in the office fear avoidance scale as well. So, Bridget, they may not be validated, but I'm becoming increasingly comfortable with using them because it helps direct treatment. So let my more qualified colleagues answer that question correctly now.
So we use the only reason that we use the PHQ-9 and the GAD-7, because it does have a lot of kind of overlapping experiences with concussion, is it's brief and it's free, and it gives you a tiny little window into how you might want to proceed further when people are answering, particularly some of the more emotional aspects of the symptoms in that inventory. You know, if I had my druthers, it would be like a part, and I kind of made one, I haven't used it yet, part catastrophizing, part kinesiophobia, part cogniphobia.
Right.
But you kind of, in your practice, have to figure out, you know, what can I get away with and still, in terms of instruments, and still have time to talk to the patient and to treat the patient.